Hello, assalamu alaikum, good morning, khush aamdeed, ji ayanu, goeiemorgen, bakhair ragale, washmele, shunishime, ladies and gentlemen. Welcome to Wild This Morning, which is a Hashmi at PTV World on a very pleasant morning. It's pleasant and very sunny over here in the Twin Cities. No quite idea about the other cities of the country as well, but of course you had the headlines and the weather updates just a while ago. Ladies and gentlemen, speaking of the updates, well, COVID-19 has taken the world over by such an, I want to say with such a blast, because we did not expect by the end of January even that something so small could actually cause such a big havoc as well. I'm talking about the coronavirus, ladies and gentlemen, and as we all know, Pakistan is not safe of it anymore. But fortunately, we're not even, close to the top 10 countries or states dealing with this in emergency right now. There are certain cases reported. I am, of course, going to tell you the exact stats and facts in a while. But before we get, deeper into the discussion, I wanted to talk about something that I have been witnessing myself, especially here in Islamabad, some parts of Rawalpindi as well, and we've been seeing a lot of videos on social media too. Well, of course, when such an emergency rises, a lot of people think about survival, and everyone just wants the best for themselves or, their own families, regardless of whatever is going to be left for the other people around them as well. So a lot of people were just running to grocery stores as well, just buying things that they don't even need, stockpiling basically. So while in such a situation, yes, of course, there are going to be, curfews and people are going to be blocked and everything, quarantine situations in different areas too. So maybe in the worst case, you may not be able to go out of the home and buy your groceries or even medicines. Yes, you should, be safe. And by safe, I mean just get what you want, the limited amount. Because imagine, what if you picked up 200 hand sanitizers and you hardly need 2 of them probably. So the others that, maybe they're waiting behind you to get the hand sanitizers, maybe they catch the virus because they didn't have enough to, just wash their hands or be hygienic enough. So please be considerate. Let's deal with this situation humanly, in a way which is more dignified, in a way which is more honorable. And rather than, just being selfish and thinking about one's own survival, let's think about the survival of the entire race. Let's deal with this collectively, because this is sort of a test from the entire universe as well. I think this is where we have to prove that when we stand united, we can fight anything as well. So please be considerate of the people around you too, because as much as you are dealing with this situation, everyone around you is too. So ladies and gentlemen, this is what we will be talking about today in detail with so many different people over here who are actually very apt for this discussion. I'll tell you why. Because they belong to the sectors of the society, or let's say the decision-making sectors, who are actually very much relevant right now in terms of, being a public health specialist as well, and forming policies, working for NGOs too, and actually being the people who volunteer to bring a change in the society, specifically in this situation as well. I was very proud to read the news yesterday. ASAB is a school in Nust, my university, and 2 of the teachers in ASAB were able to develop kits, survival kits, I want to say, for this virus, for people to be safe for them and not contract the virus. Because for all the information that I've gotten on my show yesterday and from what I've read, I know that you can be contaminated from your own hands through your ears, your eyes, and your nose and mouth. If I'm not wrong, I'm going to be corrected in a short while as well. So for that reason, the kits contain, of course, a face mask and everything and whatnot. But there are certain people who have been telling me you don't really need to wear a face mask. When this pandemic started, how face masks ran out on every single grocery store, and the ones that were left were actually, risen to the prices of 1,000 per face mask. So I wanted to ask people, is it really necessary? Or if it's not, what are some of the other ways where we can be safe, in a country which is very much safer compared to the, the epicenter of the corona thingy as well. But of course, fingers crossed, I hope it doesn't get worse. But what if it does? What do we do in that case? So let's start this conversation with my amazing panel of guests over here. On my right-hand side, ladies and gentlemen, I've been joined by someone who happens to be the coordinator for Pakistan Humanitarian Forum. He is none other than Syed Shahid Kazmi. Hello, assalamu alaikum, welcome to the show.
Thank you.
Next to Kazmi Saab, we have someone who happens to be the focal person for COVID-19 emergency response, PRCS, the Red Crescent. But here's the thing, I'm very excited to be in conversation with this person, because when we talk about COVID-19, it's such a, I want to say I learned about COVID-19 itself in 2020, from January onwards. So with a thing such as, such new as COVID-19, and then vaccines not available, some trying to develop them and whatnot, what is the future of this virus? So Dr. Adil Nawaz is here with us. Hello, assalamu alaikum. Welcome to the show, sir.
Thank you.
Next to Dr. Adil, we have someone who is dealing with the public health. He's a specialist for the public health as well, belonging from, or let's say working for IMDC. And this is such a public situation as well, because this is, of course, you don't know who might be carrying the virus as well, and you don't know who you may be in connection with. So just be safe. And let's ask him how to be safe about it as well. Dr. Ahmed Abdullah, hello, assalamu alaikum. Welcome back.
Thank you for having me.
So to begin with, I think, Kazmi Saab, when I was talking about the kits for corona as well, COVID-19 kits and face masks. Do we need a face mask?
Before going to the importance of the face mask or kits, it's a global emergency.
Yes.
And you can say the pandemic situation which came into the world.
Yes.
And suddenly you can say within last 10-15 days, the
it
index
just rose.
crossed now more than 130 countries globally. I wanted to appreciate the efforts have been taken by the government of Pakistan specifically.
Yes.
In terms of creating more public awareness, you can say creating a number of facilities in Sindh, Balochistan, and also by the civil society of Pakistan. This is something like which we should start with, and then definitely you can say about the provision of the equipments and multiple things coming up from the outside of Pakistan, from multiple countries. But I would say yes, when something like happens, like the coronavirus which happened here, and you can say we are still fortunate we are not among the top 10 countries.
Yes, luckily.
But we are still on a lower index. But if you can see, the government has decided that they will learn from the experiences from the China, Italy and other European countries, what exactly they are doing. This is something new, and nobody knows that what should be the preventive measures in terms of, because all of the preventive measures what have been taken globally, like in China, Italy or anywhere else in the world, they are something new.
Yeah.
So that based on those lessons learned or based on those learnings, the government of Pakistan is also, you can say, they are taking more consideration to it.
Absolutely. And Kazmi Saab, I think you're really right in saying that this is such a new thing that we can only learn by experience. Like there's no set formula or, a way to carry it out as well. There are no present vaccines as well, so we can only learn from each other. But Dr. Adil, speaking of the situation, can you share with us the current stats of Pakistan and where we stand?
As Kazmi Saab mentioned, actually we are quite lucky enough that currently we are quite low in the total caseload if we see in the context of the world.
Yes.
Actually right now Italy is declared as the epicenter of the pandemic.
Yes.
Pakistan was the 44th country among the world to extract this virus or report a case. But the problem is over the last couple of days, these cases are being increased, like multiplying.
Exactly.
Currently,
rapidly.
Yes, very rapidly. We need not to be panic actually. It is something which is not that fatal, and hope people know that the case fatality rate is quite low. It's around 3%. Like if 100%, if there are 100 patients, 3 amongst them have the chances to die because of this disease. 97 will be all right.
Fully recovered.
Fully recovered.
Okay.
And the other thing is that out of those 100 patients, only 20 will be needing critical care or may need hospitalization and intensive care. So 80 will get all right by even staying at home, but in isolation.
Yes, so important.
Yes.
I think the main factor that we will be building our discussion around is isolation. But before that, Dr. Ahmed, you dealing with the public health as well. For all the people out there who don't understand, can you differentiate between an epidemic and a pandemic? And how come the COVID-19 became a pandemic?
So, could you answer the mask thing?
Oh, yes,
first?
please. Yeah. I want a yes or no, please.
Anyone who has a cough or flu-like symptoms or a fever, they should wear a mask. So they don't spread their germs to other people.
Yes.
Then anyone going to areas which are overcrowded should wear a mask, so they don't catch infection from other people, or if they have that infection, they don't transfer it to other people. There are other germs that are spread through these same modes of transmission. So being careful might save us from having another outbreak as well.
All right.
Now, coming to this question, and healthcare workers, anyone who's coming regularly into contact with people who are sick, they need to protect themselves.
Got it.
So they stay well and keep on helping people.
Got it. So you don't need it in isolation?
No. So if you're alone or if you're moving out in an open space, you're not interacting with too many people, you don't need a mask.
Perfect.
the difference between an epidemic and a pandemic. So the thing is that when we talk about infectious diseases, these are the diseases that spread through germs, and they spread from person to person, sometimes animal to person, and in some cases they can spread from people to animals as well. So people who have dogs are getting infected with COVID-19 as well, who share living space. Any disease that outbreaks in a defined geographic area is an epidemic. And it's
regional,
defined
basically
on a regional basis is an epidemic, an outbreak of a disease in defined boundaries. But when these boundaries are crossed and they involve larger geographic populations, countries, continents, then this term is called a pandemic. So the term pan means complete. It talks about an outbreak on a larger scale.
But can you identify when the situation is just in the initial phase of growing? Can you identify if this is going to be massive or not?
Yes.
Yeah?
The thing is that these diseases show us patterns. These are not new patterns. If we combine the study of history and the science of spread of disease, epidemiology, medicine, we can learn from the patterns that we have already seen. So just 102 years ago, we had the Spanish influenza outbreak, which killed around 50 to 100 million people.
Oh, insane.
See, so another example is when the Europeans traveled to America, their germs killed 90% of the indigenous population.
Oh God.
So traveling increases the chances of spread of diseases.
Right. Okay. So isolation is the perfect, answer for all of this, especially in this time as well. Kazmi Saab, I'm actually going to take you back to what you said as well, of course, and I stand by his words as well. Pakistani government, the state itself has performed very well in terms of, containing and informing people and creating awareness among masses as well. This was yesterday in the morning. I was telling you guys there are about 52 reported cases, and it's sad to say, but right now there are more than 170. I really hope it doesn't increase or go further than that. But sir, in terms of awareness, we were talking before the show as well. For the masses that are belonging to, let's say, downtrodden segments of the society, or let's say the illiterate ones, there are a lot of people who are not really aware of what the situation may get. And I was also reading news about one person who just, sort of ran away or tried to escape from the quarantine, from the Taftan quarantine, and he's now missing. I mean, some say that he's probably found in Khanewal, some say in that area, but imagine for such an irresponsible person, because he knows he has the disease and he may be contaminating other people. So with this sort of a mindset, where do we begin, and how does awareness actually work here?
You can see we are the country having largest population, like top 10 in the world. So if you combine this with the literacy rate in the country, approximately 40% of the people in the country, you can say they are illiterate. And when it comes to the reactions, or you can say knowledge, attitude or practice about such situations, this is something which is really important. So creating awareness among the people and prepare them to develop some kind of coping action, and like the doctors were talking about. And you can say there are a lot of stuff happening on the social media, there are a lot of stuff happening on our lot of electronic media channels. You can see the WhatsApp, Facebook, social media, messaging services. Like the government has also initiated the messaging into multiple local languages through PTA to the mobile phones as well. But the problem is the reaction, like how people will start reacting on this.
Or taking seriously.
That is the challenge basically. That is the biggest challenge in Pakistan. If you see the whole global index where Pakistan is rated, or if we compare it compared to the China or Italy or European countries, so the dangerous situation can be, or you can say the unfortunate situation for us can be, that is like the people reaction would not be the same the people are doing in the Europe or somewhere else. So if God forbid something outbreak happens and it goes more than thousands number or somewhere at the high risk number, so you can see the health facilities and health conditions. So then you can make it more, that can make us, put us into more vulnerable situation. But it is really important, like this is the right time that we need to act like as a nation. There is no myth. We should not be panic. We need to react Combinedly, we need to react. There are a number of messages, they have been translated into local languages and they are now with the people. You can say the government institutions like provincial governments, national governments, school has been locked down, they have been closed, there are the gatherings of 4 or 5 people, 10 people is not allowed subsequently. So this is among us now, that how we are going to react.
How we deal with it.
If I could share with you the examples like you can see in the capital city in Islamabad, which could be more better. But if you compare this into some rural areas in Sindh or somewhere else, that could be more different.
Yeah.
So I believe that this is the right time that we need to react with the directions, with the messaging and with the all those standard messages which have been developed and told us by multiple tiers.
Got it. But you know, one major issue with this thing is, sir, while I agree with everything you said, in terms of, you know, social media, because everyone has the power over it, misinformation is a major factor as well. You know, and panic is actually, hysteria and panic is created by those forwarded messages on WhatsApp, you know, uncles and aunties just forwarding everything. Points, you know, of me saying this is because while we can get the exact, you know, the situation of what is going on, the exact stats on the websites of the government as well, people just for the sake of creating panic, just, I don't know, for the sake of enjoyment might write some bad, might say wrong facts, I want to say wrong stats. I'm so sorry, I have no idea why I'm stuttering early in the morning as well. But moving on to you, Dr. Adil, I'm going to sort of carry on the same question with you in terms of awareness. How serious do you think this will get, and how serious do you think we need to take as, you know, seeing that we're in the first stage?
Actually, we need not panic, as I mentioned earlier. The threat is there. There are chances of like masses getting affected, but we should not panic. It's nothing which cannot be controlled. And regarding the awareness thing, which you asked Kazmi Saab, let me introduce my organization, Pakistan Red Crescent Society. We are the largest humanitarian organization in the country. And we are auxiliary to the government and a part of like a global movement, Red Cross, Red Crescent movement, which is present in around 194 countries.
Wow, amazing.
Regarding this awareness thing, I would like to take this opportunity to convey to the people through this program, through this forum, anyone who wants to get free awareness on coronavirus prevention and precautionary measures. We are there, our headquarters are operational, and our teams in districts. Our offices are open, and we are conducting sessions for the community free of cost.
Oh, that's
our volunteers are there. Our teams are present at all the border entrances.
But sir, do you also have a helpline or something for which people can call and ask for?
Yes, we have helpline 1030. Our website is also operational 24/7, and our regional offices, their contact numbers are there, the focal person numbers are there. We have also established information desks which are available 24/7.
Perfect.
So anyone who wants to get information how to prevent themselves, they can contact us. Then for the masses, you don't need to panic actually. The best cure treatment is the prevention.
All right.
The prevention is through you mentioned a patient who fled this quarantine facility.
Unfortunately.
Actually, that's irresponsible behavior and lack of knowledge actually.
Yeah, agreed.
Running from the quarantine facility has actually put his family, his own loved ones at risk, and all those who will get into contact with him. So it's better to stay in the isolation or quarantine facility established by the government, established by PRCS. We have established the isolation wards in areas like Gwadar as well. Pakistan Red Crescent has this facilities available. Our chairman, just to mention, our chairman, Mr. Abrarullah, he was the first to hold press conferences just to alert people.
Yeah, he's so woke about all these things, right? And vocal as well.
He is, fortunately. So we don't need to actually panic. This can be controlled. As I mentioned earlier, the case fatality rate is around 3%.
Yes, and that is actually a good news sort of to look up to as well, because when you say 97% of the cases will be fully recovered, so there's hope always. But ladies and gentlemen, you know, a lot of people around me have lately been saying that Pakistan is measuring such low numbers of this, the cases of coronavirus as well, because maybe there are not enough testing facilities. Is it true? Is it not? I'm going to ask the public health specialist over here. But after I share this video with you guys, which is actually about how to take the right kind of precautions to avoid getting COVID-19. Let's take a look at it.
There are several practical measures you can take to protect yourself from the new coronavirus. One of the most important is regular, safe, and effective hand hygiene, using soap and water or alcohol-based hand rub. Here are the steps recommended by WHO to follow. You too can have safe and clean hands anywhere. Now I'm calling on the world to take the WHO Safe Hands Challenge to be ready for coronavirus.
Well, let's all promise to take on the Safe Hand Challenge as well. Dr. Adil, what do you have to say about this? The practices that were mentioned over here, are they the right practices?
Actually, you did well to play this video. This is
you.
getting viral around the globe, and a lot of celebrities, Hollywood actors and notables, they are joining this Safe Hand Wash Hands Challenge.
Oh.
We should also promote this here. Regarding this corona thing, the most important things like isolation is for those who have contacted the disease, extracted the disease. But to prevent yourself from corona, you need to wash hands. There are two basic precautions, and WHO has been like promoting all this very frequently. And they have been disseminating this message. Number one is wash your hands very frequently, so that if the people might now be knowing through this social media messages and stuff, that this virus spreads through respiratory droplets. When you cough, when you sneeze, there are small droplets which might travel to the other person. So number one thing, social distancing, keep a distance of at least 1 meter from other individual. And then there are precautions like wash hands. And the one who has cough or who is going to sneeze, you need to place your elbow like in front of your mouth.
Got it.
Just to prevent the droplets from traveling further. So if you adopt, and the China, they have controlled now, like China has lesser cases than Italy globally now. And it all started in China.
It actually did.
It actually did. But how have they controlled it? Number one, these preventive techniques, and then the isolation, like people, they were restricted, their movement was restricted. But we should not panic. In the intro, you mentioned the stockpiling thing. Actually, when you stockpile, those who are like less privileged or those who actually deserve, they don't get the stuff from market. So we don't need to panic, we don't need to stockpile. Let it be there for those who actually might need it.
That's true. And you know, I'm saying that because just yesterday I went with my sister to buy pulses. Dal lene gayi thi main, and imagine the pulses weren't, this, you know, entire shelves were empty, and I was really sort of frustrated to see that. But now coming on to Dr. Ahmed. Dr. Ahmed, I heard, please correct me if I'm wrong, that all the positively diagnosed cases in Pakistan have actually traveled or contracted it from other parts of the world. Do we have any case in Pakistan which was infested in Pakistan?
There's one reported case where a lady traveled from abroad, and then a couple of days later, her husband showed up with with similar symptoms, and he tested positive as well. So local transmission is inevitable because you know, viruses don't have a region, a country, or a religion. So we are the hosts, and this is how they sustain their selves. And this will travel from one person to another. In the very beginning of this pandemic, WHO said that we are not sure how this will affect countries with weaker health systems, and here we are.
And even, no, and you know, yes, of course, they said for weaker health systems, and they are actually at the highest risk. But imagine countries like Italy and Denmark actually, you know, making so many cases as well. And we actually look up to them for health systems and, you know, for all the facilities they have for their citizens. So ladies and gentlemen, it's not really that safe, I'm going to say, for anyone, but it's not also that bad that you create a panic situation as well. Dr. Ahmed, I also wanted to ask you about the testing facilities present in Pakistan, let's say by the government or even the private ones.
So the government is providing free testing services, but there's a criteria to fulfill, where you have a history of international travel, show those certain symptoms, or you have a history of contact with someone who has symptoms after they've traveled from abroad. And then they in Islamabad, most people are going to PIMS, and then their samples are carried to the National Institute of Health, where they are tested. The testing is, the accurate testing is being done through throat culture swabs. Because the tests from the blood are not very accurate. Considering the fact that this is a new condition, and diagnostic capabilities are being improved as we speak, but it's still an ongoing process because this is a new condition.
Right, got it. So there's a certain eligibility criteria for you to go test for free, and if you have traveled in the past 14 days, is it?
Yes.
14 days, right.
I would like to add something here.
Yes, please.
Like, first of all, Federal Minister for Health, Dr. Zafar Mirza, probably yesterday he mentioned that the government of Pakistan has established 13, in 13 cities they have established this diagnostic facility. Number two is the WHO Chief Director General. He held a press conference yesterday. He was addressing that, and what he mentioned was, we know everything, like how to prevent and how to avoid this thing. But the important thing is testing. The first and foremost step is testing.
Absolutely.
If you are blindfolded, like you don't know how many cases are there or how many people are actually there, because there are certain confusions between common cold and flu and stuff. But the first thing is you have to establish that this person has corona. Then he can be isolated. You cannot isolate every person who is coughing or sneezing and stuff. So the diagnostics are really important. We need to get ourselves checked, but if we have the symptoms, cough, fever, and shortness of breath, difficulty breathing. These are the most common symptoms of corona.
Do we have to, like, I want to ask you, I don't know how to put this to words, but do we have to wait for it to get prolonged, like in terms of fever and cough?
No, not actually. Once you get the virus in your body, the average time is for the symptoms to manifest is like 5 days. But it may take, but it may take 2 to 14 days. Like the fever may appear after 14 days.
And the cough may be before
And the cough may be before that, or it may take 2 to 14 days. So you might not know that you have the virus in you until and unless the symptoms are developed. But once the symptoms are developed, and they are like, out of these three, they are typical of the coronavirus, the first thing, you should go to a healthcare facility, get yourself diagnosed, tested, and if you are confirmed to have the corona, do good to yourself, your loved ones, your family. Stay isolated.
Absolutely. Thank you so much for saying that, ladies and gentlemen. This
could
is
I
the key.
add something over?
Yeah, please.
We need to understand the difference between isolation and quarantine. So isolation is for someone who is a confirmed case of any condition. And quarantine is when you separate the apparently healthy
suspected
contacts. They've contacted someone who has the actual condition, and then they're apparently healthy. So you isolate them for the longest incubation period of the disease, which in this case initially they said that it was 14 days, but now they are talking about 21 days.
Oh, got it. And this is such a technical difference actually. I knew about both of them, but this very different side, and thank you so much for informing as well. Ladies and gentlemen, a lot of people, and I want to confess this, including me, are frustrated over the fact that you have to limit social gatherings and public gatherings as well. Some say it can be up to 12 people, some say it is now up to 4 people as well. What is the actual reason behind it? Are we going to observe it strictly as well? And why is the government sort of, imposing this onto us? This is what we will be asking this amazing panel of guests. But right after this very short break, so stay tuned to find out more. Good morning. Welcome back to Well This Morning, which is a Hashmi, ladies and gentlemen. And today we are trying to inform you and learn ourselves as well about the ongoing situation of the pandemic of coronavirus all around the globe as well. What are the current statistics in Pakistan? What is the current situation? And how severe is it going to get? And how serious must we take it? Now, gentlemen, you guys have been giving an amazing information to all my viewers as well, and including me too. But now I want to talk about how the government is sort of, strictly asking people to not gather publicly, and maybe not more than 4 people should get together. Weddings have been cancelled, schools, universities, everything has been, sort of blocked and cancelled. So why so, and is it the right approach?
I think yes. The first thing which has been, you can say, under the restricted actions to combat with this coronavirus thing is to avoid people's social gatherings.
Yeah.
That is something great. I think the government has decided to close down the schools, and multiple, like yesterday Punjab government has taken few initiatives. I guess they have been already taken by Sindh government and now federal as well. I would strongly say the one thing which we as a nation need to adopt and to work on is to avoid from the multiple misinformations.
Right.
Like you can see in your inbox, there are thousands of informations coming up to one hour. So there are many scientists, everyone is like producing new thing. So the best source of information in Pakistan is now, if you wanted to see the current projections or you wanted to see the index where it's going on, you can go on a live dashboard which has been created by the National Institute of Health, Government of Pakistan. You can always see the updated information, and you can see very proactive Federal Health Minister. He's coming up daily live, doing a press conference and sharing everything in the evening. So that is the best source of information.
Agreed.
And third is to approach the right centers where you wanted to consult. And even I think we already have established a helpline as well. And you can call to that dedicated helpline across the country, and you can ask to the people, if you have any symptom, you wanted to approach any health facility, you wanted to go to any doctor, or you wanted to go to a government hospital. I think we all should be more like proactive. We should act on the precise informations. We should tell to other peoples, we should tell in our locality, we should tell into our street, we should tell to the elders, and elders specifically are the more, you can say, vulnerable to this whole scenario. So this is our this is a time where we should act more proactively, and we should act as a nation. And hopefully, inshallah, this will be something
that we will defeat.
The whole world, we will be able to defeat this. This is a difficult time for all of us, but this matters that how we are acting to this.
Absolutely. Dr. Adil, what do you have to say about this, sort of the strict impositions going on in terms of public gatherings?
Public gatherings, Kazmi sir mentioned it, and you asked that. Actually, public gatherings, it's not about like 4 people cannot gather or 400 cannot gather, like the marriages, marriage halls and schools and stuff. This coronavirus, this has affected now more than 150 countries. Probably it's like the clock is ticking, the number is increasing, and it's probably 160, around 160 right now. There are certain countries which imposed curfews in their cities. The people have been quarantined or isolated in their homes, because this is the only way you can restrict the transmission of this coronavirus.
Got it.
All these measures are necessary. We should not panic. We should not. I'm using this word panic again and again, but just to let people know that this is nothing which is life-threatening. Not even this closure of the schools or holidays being announced and stuff. Right now, according to WHO, Pakistan is amongst the green,
we're safe in the green zone.
Actually.
Yeah, got it.
By the end of this week, it will be decided whether we are jumping upwards to the orange group, or we will remain in the green one. Right now we are in the green one, but restrict your movement. Restrict your movement. This is the only way you can keep yourself safe, and keep your family safe.
Got it. And this is I agree with you. And when you said that you were talking about panic again and again, I think that is the right approach we have to take over here, especially on the state TV too. Ladies and gentlemen, the only type of information everyone is putting out, especially the state channels, the state social media channels as well, it's for you to be informed. Do not resort to any sort of other, platforms of information, because they are the ones giving you the right kind of stats that you need to have. Now, Dr. Ahmed, when this thingy started, the pandemic started, it didn't reach to Pakistan yet, but everyone was talking that, COVID-19 cannot actually grow or survive beyond 28 degrees centigrade. And now WHO declares that this has nothing to do with heat as well. So what are we looking at? Is it actually a thing? Does it have something to do with the temperature?
Because this is a new condition, we're still learning. And as it is traveling to different parts of the world, we're learning more how it interacts with the climate, with the people, with the genetics. So this is learning is an ongoing process.
Got it.
WHO Philippines broke the myth that temperature or hot or humid climate doesn't have anything to do with it. It's summers in Australia and New Zealand, yet they have an outbreak. So we're not sure. We could talk about the temperature of surfaces where it could survive, or the effect of surface cleaning agents that we can regularly clean our surfaces with.
But not the environment.
But not the climate, because we're still learning. It's an ongoing process.
All right. And we really don't, like you said, this is because a new thing, so we're still learning. As time passes, we will have the right kind of information about how it grows and how it stops as well. Yes, please.
Actually, this myth, it all, the origin is from the viruses. Generally, the viruses, the optimum temperature for viruses to grow is like around 30.
Okay.
So this myth originated from that fact actually.
So they generalized COVID-19 with any virus.
Exactly. But there is no established fact up till now that at how much temperature or what is the optimum temperature for this coronavirus to grow and stuff. There is no established fact. The research is going on, but according to an institute like John Hopkins, even their studies, they did mention that viruses, the optimum temperature for viruses to propagate and grow is around 30. But for this particular coronavirus thing, nothing is as yet finalized or established scientifically.
All right, so we're learning, we're in the process. But ladies and gentlemen, you know one thing very exciting and funny I want to say as well, there's a certain segment of the society in the entire world who still believes that this is sort of a biological warfare or a conspiracy theory as well. It's interesting. I'll tell you why it's interesting, because it's a perspective, of course. And when you think about it, we're in the 21st century, there are hybrid warfares going on, and you never know what might come up next. So to think of a biological warfare that has been declared by one nation upon another in the wake of becoming a superpower, and which is often sort of confirmed by Donald Trump as well. Like I'll give you an example. In a tweet, he says that all the organizations or the airlines that have been affected by the Chinese virus will be helped by the USA. Why do you have to call it a Chinese virus? And then again, one very interesting thing and alarming thing for me to learn was yesterday I was reading news and coming across videos which said that Germany and the US have said that if and when they do develop a vaccine to treat this virus or to be safe from this virus as well, they will not share the copyrights. So I don't know what's that supposed to mean. Aren't we supposed to fight this as humans together? Dr. Saab, what do you have to say about this? But before that, Kazmi Saab, what do you have to say about this? Do you think vaccines will be developed sooner or later? And when they are, what is it going on with not sharing the copyrights?
I think it's too early to say, this is a global issue.
Yeah.
And I should not, I cannot comment too early on this, but
got it.
I hope that we, as I said earlier, that we as a world humanity, world globally, we all would be able to invent something or to come up with something. But I can see this is just like, I'm basically a climate change professional and I'm a climate activist. So I can link a lot of things happening in the world in the future. So might be we as a world, we need to get ready to combat, to prevent and to fight with a number of things which are coming in the world.
Yes, agreed.
But as you said, I could not read yet, I could not hear about America or Germany. They said that they are not going to share the copyrights. But yes, there is bit politics, the global politics, you can see that, and that affects everything. And there is a lot of economic, you can say fight, or you can say economic competition in everything, in each industry in the world. So, but for this might be, I'm sure that if it prevails in next 2-3 months, we would be able to come up with more solutions.
All right, that's great. Thank you so much for saying that. Now, since we are short on time and we have to wrap up the show as well, Dr. Adil and Dr. Ahmed, I'll quickly ask you guys to give out a message to everyone watching right now on how to be safe in this. Of course, we have been talking about it, but to, let's say, wrap it up in a line.
Just a few steps. Number 1, wash your hands very frequently. Number 2, use your arm or elbow if you have to cough or sneeze, actually, just to prevent other people. And number 3, avoid public gatherings. Try to stay home because you need to be safe. Actually, these type of situations and the emergencies, they define the nation. As a Pakistani nation, this is the time that can build us or break us. Do cooperate with the government, do go out and get the relevant information, but this is not life-threatening. Stay safe.
Thank you so much, sir. What about you, Dr. Ahmed?
Hand hygiene, respiratory hygiene, avoid too much social contact, and build your immunity through exercise and good diet. Stay away from negativity, because that has a burst effect on our immunity.
Absolutely. And that negativity is a virus on its own.
Yeah.
Thank you so much for saying that, gentlemen. You guys were amazing. Thank you for all the information and knowledge you gave out to me and my audiences as well. Ladies and gentlemen, as you know, you heard it from the horse's mouth himself, it's not really there to panic about. Of course, I mean, safety comes first. So as a person, you have to be responsible. And of course, you have to be safe for yourself, for your family around you as well. But do not panic and do not create panic by, sharing false information as well. And if you were watching the show as well, we showed you a precautionary video shared by the WHO, which sort of wanted to generate a global challenge on social media. You can become a part of it. It's called Safe Hand Challenge. And I, on behalf of World This Morning on PTV World, I request you all to please become a part of this challenge and share your videos with us. Maybe it's a picture, maybe it's a video. If you're washing your hands, talking about your hygiene, the Safe Hand Challenge, make a video, make a picture, share with us on our social media pages. Facebook with the name of World This Morning, on Twitter with the name of World This Morning without a G, Daily Motion on YouTube. You can check out the videos on the PTV World channel and also Well This Morning. Till the next time, take care. The repeat is going to be at 11 p.m. tonight. Good morning. Be safe.